your health news this morning, today is Overdose Awareness Day, and that means today we remember the lives lost to substance abuse. Sophia Lesios is here to tell us more about signs to look out for and what we can do to bring awareness to this ongoing issue. Good morning, Sophia.
Good morning, Jessica. Well, in 2017, the Department of Health and Human Services declared a opioid crisis in the U.S. That crisis is still in effect today, 5 years later. The overdose crisis is national, but this impact is very personal. Since 1999, the rate of overdose deaths nationally has increased by 250%, according to the Department of Health and Human Services. Prevention is critical, and reducing overdoses and overdose deaths and education is the first step. And following tips from the Department of Health and Human Services can help you or a loved one avoid an opioid overdose. Take medicine as prescribed by your practitioner. Do not take more medicine than needed or take it more often than it is instructed. Never mix pain medicine with alcohol, sleeping pills, or illicit substances. Never take anyone else's medication. And you can prevent children and pets from accidental ingestion by storing your medication out of reach. The sheriff's office or police station does have a disposable medication for safely disposing medication. Don't put it in a trash can. Casey Skilpruit, the public information officer for Yakima County Sheriff's Office, tells me that education is very important when it comes to substance abuse.
Maybe it's a conversation that hasn't been had yet, or they're getting false information or information that's not quite true from other sources. So it's important that families talk about this. It's, that they know that it's a problem. Whenever they see these type of pills, definitely don't touch them and don't take them.
Most overdose deaths have involved opioids, specifically fentanyl. Opioids are a type of drug commonly used to reduce pain. Now, opioid overdoses and are life-threatening, and it doesn't require immediate attention. So recognizing the signs of an opioid overdose is essential in saving lives. The Substance Mental Health Services Administration says to call 911 immediately if a person is showing symptoms. Those can include things like their face is extremely pale or feels clammy to touch, if their body goes limp, their fingernails or lips have turned purple or blue, they start vomiting or making gurgling noises, they cannot be awakened or unable to speak, and their breath or heartbeat slows or stops. Now, we do have more information on Overdose Awareness Day, and you can find more signs to look for on our website at nbcrightnow.com.
So, Sophia, you said earlier that there's an event planned in Yakima today about Overdose Awareness Day. Can you tell us about that?
Yes, of course, Jessica. Well, Triumph Treatment Centers are hosting their 6th annual International Overdose Awareness Day at Sarge Hubbard Park from 3:30 p.m. to 6:30 p.m. today. There will be some guest speakers, including Dr. Gillian Zuckerman, head of community health of Central Washington's Connect Opioid Addiction Program, Jerry Gilnado of the Davis CAN program, Jolene Saida, the Triumph CEO, Dr. Kelly Oslin, the neurologist who will be a president of New Report on Illicit Drug Trends in Washington, and of course our own Yakima County Coroner Jim Curtis. Now, the event also has a tribute to those who have died because of an overdose, and you can find more information again on our website at nbcrightnow.com. Jessica?
Thanks, Sophia. And we're committed to being transparent with you. So if you take a look at your screen right now, you can see these are some of the sites where Sophia got her information for the story. And we'll have these and the others she used all linked on our website, nbcrightnow.com.